Missing Ebola patients spark alarm. And that's the headline for now. We'll be back soon with more breaking stories and major updates from across Nigeria and around the world. Stay tuned and thanks for watching. Health officials are raising serious concerns after hundreds of Ebola patients reportedly went missing from treatment and monitoring programs, increasing fears that the deadly virus could spread beyond affected communities. Authorities warn that losing track of infected individuals could undermine efforts to contain the outbreak and put more lives at risk. Here are the details. Health authorities are intensifying efforts to locate hundreds of Ebola patients who have disappeared from treatment centers and monitoring programs during the current outbreak. Officials say the missing patients have either left medical facilities without authorization or have become unreachable while under observation. Their disappearance has raised fears that infected individuals could unknowingly transmit the virus to family members, friends, and others in their communities. Ebola is one of the world's deadliest viral diseases. It spreads through direct contact with the blood or other bodily fluids of an infected person or someone who has died from the disease. Symptoms often include fever, severe weakness, vomiting, diarrhea, muscle pain, and in severe cases, internal and external bleeding. Health experts explain that early detection and isolation are among the most effective ways to stop Ebola from spreading. When infected individuals cannot be located, contact tracing becomes much more difficult, increasing the likelihood of new infections. Contact tracing involves identifying everyone who has been in close contact with an infected person. These contacts are monitored for symptoms over several weeks to ensure that anyone who becomes ill receives prompt medical care while preventing further transmission. The disappearance of hundreds of patients has disrupted this critical public health process. Officials say every missing patient represents a potential chain of transmission that could expand the outbreak if not quickly contained. In response, health workers are working closely with local authorities and community leaders to locate those who have gone missing. Public awareness campaigns have also been strengthened to encourage people experiencing symptoms to seek immediate medical attention instead of hiding or avoiding treatment. Health agencies believe fear, misinformation, stigma, and distrust of medical authorities remain significant challenges. In some communities, people worry about being isolated from their families or facing discrimination if they are diagnosed with Ebola. Medical experts continue to stress that seeking treatment early greatly improves the chances of survival. Modern supportive care, including hydration, medication, and specialized treatment, has significantly increased recovery rates compared with previous outbreaks. Authorities are also urging communities not to stigmatize Ebola survivors or affected families. They say fear and discrimination can discourage people from reporting symptoms or cooperating with health workers, making outbreaks harder to control. International health organizations are supporting national authorities by providing medical supplies, laboratory services, surveillance teams, and technical expertise. Emergency response teams are also expanding public education campaigns aimed at improving awareness about Ebola prevention. Experts recommend regular hand washing, avoiding contact with the bodily fluids of infected individuals, following guidance from health officials, and reporting suspected cases immediately. Border health screening and surveillance measures have also been strengthened in some areas to reduce the risk of cross-border transmission, while allowing essential travel and trade to continue safely. Health authorities emphasize that the public should remain alert but avoid panic. They say outbreaks can be contained when communities cooperate with medical teams, report symptoms quickly, and follow recommended public health measures. Officials continue searching for the missing patients while expanding monitoring efforts to identify any new infections as early as possible. The disappearance of hundreds of Ebola patients has created a major public health concern, but officials remain committed to containing the outbreak through surveillance, contact tracing, public education, and timely medical care. Health authorities are urging everyone to cooperate with response teams, rely on verified health information, and seek immediate treatment if Ebola symptoms develop. Thank you for watching. If you found this report informative, please like this video, subscribe to the channel, and turn on the notification bell for more trusted news updates. Stay safe, and we'll see you in the next report.